going to start off with my BSI, my scene is safe. I have one patient. No, we don't need any additional resources. The mechanism of injury is unknown at the time. We do not need extrication. Spinal precautions are unknown. So now I'm going to take my general impression of the patient. He seems to be early 20s, Hispanic male. And now I'm going to test for the level of consciousness using AFPU. The patient is alert because when I walked up on him, he saw me. Now I'm going to test for verbal response. Hello, sir. My name is Eric Davis. Can you tell me your name?
Eli.
Eli. His verbal stimuli is good. So this patient is deemed conscious. All right, now I'm going to go assess his airway, breathing, and circulation. He's able to speak to me, so I know his airway is clear. His breathing seems to be adequate. And I'm going to check his circulation using capillary refill. Can I access your hand, please, sir?
Sir.
His capillary refill is perfect, so his circulation is fine. Now I'm going to start with history taking, starting with OPQRST because the chief complaint is chest pain. So, excuse me, sir, can you tell me when the pain started?
Yeah, it started, I was running and I started feeling pain in my chest.
Okay.
Hurts so much.
Does anything make it better or make it feel worse?
Just sitting right here makes it a little better.
On a scale of 0 to 10, 10 being worse and 0 being nothing, can you give me a number how bad the pain is?
It's a 7, I think.
7?
Yeah.
Can you describe the severity of the pain? How does it feel?
I just feel this just hurts a lot.
How long has the pain been lasting?
It's less.
Like 15 minutes.
Yeah, it's less since I was running like 20 minutes ago.
Okay. So now since we assessed that the chief complaint is chest pain and we've gone through OPQRST, I'm going to go through the sample history now. Starting with S, the signs and symptoms is chest pain because he's holding his chest. Excuse me, sir, can you tell me if you're allergic to anything?
No, I'm not allergic to anything.
Have you taken any medications today?
I don't take medications, sir.
Can you tell me, have you had any past medical issues?
Not really.
Can you tell me the last thing you ate today or anything you're drinking?
I'll just say a piece of chicken.
Okay, so since we already know he was running when the pain started, we know the events that led up to the pain. Now since we've gone through our history taking, we're going to go through the secondary assessment, and this seems to be a cardiovascular emergency. So now that I've completed the secondary assessment, I'm going to take the patient's vital signs, which is the blood pressure, the pulse, and his skin signs and breathing. Sir, is it okay if I take your vital signs today?
Yeah.
I'm going to start with taking his blood pressure. After taking the patient's blood pressure, I got 140/90. So now I'm going to check the patient's pulse. Excuse me, sir, can I see your hands for me? So while checking the patient's pulse, I got 100 beats per minute, and also while doing that, I checked for the patient's breathing. The patient's breathing is 14 breaths per minute, which is in a regular range. So since it seems to be my working diagnostic is angina, stable angina, I'm going to administer nitroglycerin, and then on the way to the hospital, I'm going to reassess the patient every 15 minutes to see if his condition worsens or gets better.